Rankings are an easy way to convey information in a easy and understandable fashion. We all like rankings, and we all use rankings every day in our daily life. We rank our best teams, we rank our schools, and so on and so forth. So it's a way to communicate to people, decision makers and community leaders, complex public health information, and to enable them to compare to their peers to see how well they're doing. The health outcomes are the things that most people would immediately associate with health, so primarily disease and deaths. The health factors are things that people most of the time don't think immediately about them as health-related, but in fact we know from research that they can have a big impact on how healthy we as a community are. Things like education or the condition of our environment, for example, they can really have an important effect on how much disease and deaths are in a community. A change from last year may mean that there was a real change, but perhaps more likely, if it is dramatic change, it may mean that there is different or new information that was introduced in the report, or simply that the county is relatively small, so when we count events in that county, those events can change just randomly. I think the rankings can be very helpful to stimulate the discussion in the community. That's really the main purpose. So don't just get stuck on who is number 9 compared to number 10. Just again, look at the big picture. What does it tell you about your community that you already knew or that you didn't know? There are a few things that the rankings cannot do for you. They do not show the distance between the top and the bottom county. It's very possible that someone would be at the top and someone would be at the bottom, but they're actually very close to each other, and so those distances may not be very meaningful in practice. The other important thing that the ranking cannot do is to give you a sense of disparities within each county. And I would urge even the counties that are at the top of the rankings to look carefully at those numbers and identify those pockets of population that may actually not have as good outcomes as, on average, the community in the county does. First of all, talk about it. Just talk about it with your community leaders, with your community organizations, with your elected officials. Try to understand what's behind those numbers. It's not just about whether you're number 9 or 10. It's about what does it tell you about your own community. Then make a plan, and I would suggest that you probably want to work on 2 parallel tracks. One in which you can identify some goals that can be relatively short-term, things that you can have an effect on, changes in policies, for example, smoking restrictions in public places, things like that can have an effect that's measurable over a short period of time. But the other track is more the long-term track. If there is one thing that we learn from these rankings is that a variety of socioeconomic and behavioral factors that can have an impact on health don't change over time very quickly. They change slowly. But at the same time, they're probably the most important things that we need to change if we want to assure our communities a healthy future. So we need to do long-term work on those factors so that we can build the base for healthier communities in the future.